CEO of one of the major airlines says he's taken a 10% pay cut as the airlines are experiencing a slump in traffic, stock down. The Pope is telling priests to go out and meet sick people. Israel, as I mentioned last hour, requiring anybody entering that country to be on a 14-day quarantine. German hospitals created a drive-through for testing. And here's what the president and the vice president said today in a meeting with health care CEOs.
I'll ask Vice President Pence to maybe give us a little update as to where we are.
I'd be very happy to. Thank you, Mr. President. President Trump made it clear from the early days of the coronavirus in the United States that this would be a whole-of-government approach. We've brought the full resources of the federal government to bear. But this president has also called together businesses and industries to make this a whole-of-America approach. Last week at this table, the president met with pharmaceutical leaders. We met with nursing home leaders, the leaders of commercial labs, airline industries. We're bringing all of the businesses of the country to bear to protect the health of the American people. But today, Mr. President, you directed us to bring together insurance companies, health insurance companies that cover through private insurance and through their support of Medicare and Medicaid, almost 240 million Americans. And I'm pleased to report, as you requested, Mr. President, that all the insurance companies here, either today or before today, have agreed to waive all co-pays on coronavirus testing and extend coverage for coronavirus treatment in all of their benefit plans. And at your direction, Medicare and Medicaid last week already made it clear to Medicare and Medicaid beneficiaries that coronavirus testing and treatment would be covered. These private insurance carriers have extended that as well. They've also agreed to cover telemedicine so that anyone, particularly among a vulnerable senior population, would not feel it necessary to go to a hospital or go to their doctor. They'll know that telemedicine is covered. These CEOs have also agreed to no surprise billing. We want people to get tested. Over 1 million tests are out, thanks to the diligent work of CDC and HHS. More than 4 million will go out this week. You've worked with commercial labs to expand testing, and that'll continue to increase by the day. But we want the American people to know that they are covered through private insurance. They are covered through Medicare, Medicaid, and there'll be no surprise billing. And finally, Mr. President, as you directed us yesterday, we produced helpful information for every American family, how they can keep their home, their school, their business, their establishment safer from the spread of the coronavirus. All of these major health insurance companies have agreed to convey all this information starting today to all of their customers, as well as to send the CDC's guidance for seniors with underlying health conditions to give them specific recommendations. And so, as you requested us, they've all agreed to work with us to communicate information directly to the American people. Because as you said, Mr. President, while the risk to the average American of contracting the coronavirus remains low, we want a full partnership with industry and give the American people all the information they need to avoid contracting or spreading the coronavirus. And particularly, these companies are going to help us get information to seniors with underlying health conditions who really represent the most vulnerable population to serious outcomes. And I know I speak on behalf of the President when I say how grateful we are for the collaborative spirit, the generosity, and the partnership represented by the great companies at this table.
That's true, very true. And we are working very closely with the cruise line industry, and very, very closely. They're taking very strong steps in terms of people going on and going off. But they're spending a lot of money, and they are working very hard, and we're going to be helping that industry Likewise with the airline industry, they're taking very, very strong steps for people coming into our country, even getting off the planes. So we are working very closely with them. We're helping them. They're two great industries, and we'll be helping them through this patch. And so far, I think it's been going very well. You know all about the big ship that came in yesterday, and that's going along incredibly well, working with the state of California successfully, very successfully, also with Canada and with UK. So the UK is taking their people, their citizens back, and Canada is about 600 people. They're coming back. They're being met and brought to planes and being brought very, very, in a very, very dignified fashion back into Canada. So we appreciate all of the help we've had in that, and that's working out very well.
Now, there's a piece in the New York Post headline, How Iran's Regime Set Off a Coronavirus Bomb on its own economy. Here's what it says in part, quote, by sacrificing public health to politics, the clerical regime turned Iran into a coronavirus bomb exploding across the Middle East. When the epidemic broke out, Tehran failed to cut, limit, or even supervise contacts with China. As always, ordinary Iranians have been the main victim of the Islamist regime's incompetence and psychopathic indifference towards its own citizens. Beginning in late January, social media reported cases of the virus in Iran, especially in the holy city of QOM. Not quite sure how to pronounce it. Do you know, Mr. McConnell? Check it out for me. Guam. Rather than taking action, the regime issued denials and accused the individuals who reported the problem of, quote, spreading rumors, end of quote. The result, 1 month later, is an official death toll of 77, likely massively understated, while the country's deputy health minister admitted to testing positive for coronavirus the day after a news conference at which he sweatily insisted the situation was under control.